Hello. So today where I was wanted to do a video on the wasteful corruption your tax dollars are going to. So there's a lot of misconceptions about government waste and where it's from and what it is and taxes in general and a lot of things. A lot of the things we think are wasteful aren't wasteful. A lot of the things that we think aren't wasteful have waste in them. If you're just cutting things, you aren't attacking waste. Politicians, that's the easy and the bad way and the austerity way out. That's not how you fix the problem. Today, I'm going to explain where your tax dollars are going to and where they go to, but they shouldn't. So get ready. Oops. My dad served in the Army, and this was back in the 1970s. So, and he said that the US Army would pay $9 for a single bolt. Single bolt, not anything special, not a packet of them, a single one. That's ridiculous. I'm not sure if that's in terms of inflation, but that's just absurd. Whatever it is, anywhere you look at it, that's absurd. That's absurd in today's dollars, not to mine 1970s dollars. That's a very good example of where waste comes from. First off, let's look at our defense budget. Our defense budget could be a lot smaller than it is, and still, we would still have the largest, most technologically capable, and the most powerful military on earth. Currently, our budget is, well, this is for last year. Now it's over 800 billion because we decided we need to raise it again because for whatever reason, it's larger than the next 10 combined. It's about half of the world's total defense spending is the US. It's larger than all of our enemies combined by several over. I mean, in this list of countries here, the only two enemies we have are China and Russia. Yeah, China and Russia. It's ridiculous. That's a lot of money. And to make matters worse, this is a map from 2015. Most of our troops are not in places where that necessarily today make much strategic sense. They're not in war zones, which makes no sense. Most US troops, this is exempting US troops, most US troops are in the United States. But the largest places that we have troops are Japan, which kind of makes sense due to the Pacific Ocean, its relative proximity to China and Taiwan, and those areas, in South Korea. South Korea, because of North Korea, that relatively makes sense, but does it make sense in those numbers for those developed countries to have such a presence? Meanwhile, in 2015, we had 9,000 troops in Afghanistan. We pulled 9,000 troops out of Afghanistan in 2020 just so we could put 6,000 back there to evacuate civilians. And then got soldiers killed in the process because why not? Apparently. Oh boy. Because that was such a fiasco. Then it's also Germany. And why Germany? Germany has no strategic relevance of anything anymore. The only okay, if Poland, that makes sense. Poland makes sense because it borders Russia and Kaliningrad, and it borders Belarus, which is a Russian puppet state, and it borders Ukraine, which, of course, we unfortunately know the things going on with Ukraine and all of that. So, but today, it may have made sense in the Cold War, the first one. We're in the second Cold War now. It may have made sense back in World War II for obvious reasons. It does not make any sense today. It doesn't make sense that we have 8,479 troops in the UK or 3,256 in Spain or 12,000 in Italy. Why those countries? Those countries have no strategic purpose today. Why? It doesn't make any sense. Yeah. Boy. Also, there's the F-35 fighter jet, which is a really cool plane because it's stealthy and it can fly past enemy radar. It can do vertical takeoff and landings, and it has many other cool features. But it's cost over 3 trillion. Now it's over $3 trillion to make. And the government, when it got to 2 trillion, said, it's too big to fail now. Everybody has signed on to it. We need to keep going. And then you added another trillion to it. And yet this plane can't fly in Lightning, which is its namesake, F-35 Lightning. It can't fly in Lightning. And this is the type of stuff that's, yeah. Or the USS Zoomwall, which unfortunately has been canceled, which was because Congress required the Navy, even though the Navy said it didn't want to have to create a modern battleship, despite the fact that today modern battleship isn't really a thing that's needed in any way. And they created this stealth battleship Zoomwall, which ended up being too top heavy and would list and it wouldn't sail correctly. So they had to scrap the project after they made the first one. Jeez, my God. And then there is the fact of how we produce all this stuff and produce all this military technologies. We try to make, the Congress tries to make it as diverse as possible and produce as many parts as in many places in the US as possible. That way, as many congressional districts can get as much employment as possible. In Maryland, here is a map of how many DoD or Department of Defense contracts there is, which is outright ridiculous. Every place has between 6 and 327 contracts, apparently, which is just downright insane. There's also a map of North Carolina for this that I didn't include, but this is a map that of the other map is of production, but you can't really see everything here, especially because Maryland's not even part of this map. Really? Why is this blank? Oh, that's why. So here's we're going to go to Medicare and Medicaid. I didn't include Medicaid in this, but Medicaid suffers from a similar problem. So we're going to go to there. And it's the reason why also politicians say it's like single payer is unaffordable. And yes, under Bernie Sanders' plan, possibly it could be. It could have wait time, but that's not to say that single payer itself would be that way. I will have to do a video on like the complexity of that type of policy, those type of policies. But long wait times is a thing you can try to avoid for the as much as you can. Canada does have really long wait time, but you can avoid them. Most countries don't have, with single payer, don't have them as long as Canada, but that's another subject. We're talking about how the healthcare system is funded. In Medicare, it costs $12,000 per patient to the American taxpayer on Medicare. And each person using it, I don't know what, each person using it has premiums and they have to pay. And it only costs or over covers without Medicare Part C, which is the public-private thing. It only covers hospital stay, home care, and most inpatient and outpatient services, preventive exams, and most prescription drugs. It doesn't cover as much as NHS. NHS is the British healthcare system, which costs about $4,000 per patient to the British taxpayer. And unlike Medicare, which only covers everyone over say age 65 and with certain disabilities, NHS covers everybody. It's also, NHS is free at point of use. There are only a couple exceptions, like copays for dental and copays for certain prescription drugs which aren't covered by NICE, which are very rare or aren't approved of. The last one is, I forget now. What's the last one? Oh, long-term in-home care, which you have to pay premiums for. But everything else is covered free of point of use, including mental health services, maternity care, long-term community care, prescription drugs, inpatient and outpatient services, reproductive care, vision, hearing. Yeah, all of that stuff, completely free. But yet, even though it covers more people, more things, it costs $4,000 per patient to the British taxpayer, which is 1/3 of what Medicare pays, despite patients who have it having to pay into it and covering less. The taxpayer has to pay more for Medicare. That's because that's because of politicians put loopholes in law. For example, you can't negotiate price. Medicare can't negotiate prices. It can't set prices like it can in the UK. So therefore, pharmaceuticals can charge out of the wazoo, just like they charge taxpayers for medications, and they can charge the government more because they know, because it can pay, because it will just have to charge a taxpayer on the other end. So that's what's happening. It's ridiculous how much the taxpayer pays for this, and that's a lot of our debt and of what the taxpayer pays is this. Medicare for all would be affordable. It would cost more than what we currently spend on Medicare and Medicaid, yes, but it would be doable if it was not for these things. But yes, you can change them. You can do that, but I'm not talking about that in this video. Also, the delivery of services in the US really bad. There's duplicate uncoordinated services. Like local has services that are also duplicated at county, and it has to duplicated state level, and then duplicated at federal level. That shouldn't be. One service for the most part should cover that. Maybe there's another level that that's not their main thing, but they can get into that if not covered by a lower level. But there shouldn't be this many levels of redundancy. There should not be. That's just a lot of taxpayers' money that's being funneled on the wrong thing. Another thing, municipalities in the US are a lot of times too tiny to actually have very good effect. They're too tiny to be sustainable and have enough money to fund things. That's another problem. Many municipalities should be much larger than they currently are. Another thing, privately implemented services. The government, and by privately, I mean for profit. A lot of, like for example, the ACA or many other places, the government will contract out for-profit companies to do work for it. The for-profit companies will charge the government more than many times it could do it to itself. Maybe it's a bargain at the beginning, but eventually it becomes something that's not a bargain later on. It becomes more costly for the government to do it than they would be able to otherwise, or they would be able to do it in-house. If you're going to, but then again, the government also implementing stuff costs a lot of money in itself, because how the government is structured, it just doesn't necessarily incentivize bureaucrats to do things more efficiently, especially if they're political appointees. Civil servants, it does, but not as much. And the money's, so what you need to have is nonprofits to implement these services. Nonprofits, people get in the nonprofits because they care about it, not because they get paid a lot. People get in the nonprofits, or nonprofits will have that set budget, and also things should be done not pay as you go. Instead, have it, but not all, so you don't cancel a budget or cancel when they haven't spent as much as their full amount that they spent, because then be incentivized to spend the rest of it, which they haven't spent all of it, even when they haven't spent it, when they have nothing real good to spend it on. So you can't save money. That's a problem. You need to be able to save it. Now, if there's too much savings, the government should be able to remove that and cap it if they have to put more in their savings, but it shouldn't reduce their budget. That's another thing they didn't put in here. Here's their federal budget. Oops. Here's the federal budget in 2019. Net interest, 8%. That was just on the national debt. Social Security is 23%, Medicare is 14%, Medicaid, CHIP, the ACA subsidies are 12%. So that all those entitlement programs and some more programs take up a lot of the budget. CHIP, Medicaid, and ACA, and them take a lot of the budget, but also defense does. Defense is 15% of it. That's a lot. Other mandatory programs take 12%, non-defense discretionary takes 15%. Mandatory programs are programs that Congress doesn't change in its annual budget legislation. Discretionary are what it changes in its annual budget legislation. Oops. Here's discretionary spending specifically. Most 53% of the 2019 budget was military spending. Why? It's on wars that don't exist, spending it on bases that have no strategic purpose. Why? The rest of it was split between all of these different ones, which are a lot, all the different departments and all of that. And people talk about food stamps as being part of why we have so much the national debt, or why the budget. First of all, if it's going to the poor, you should be okay if someone can feed their families. Most people that are on food stamps do work. Many states there are work requirements for it. So that's kind of bogus right there. Don't blame somebody else that's poorer than you on your own problems. You know, if you want biblical references, go look. In the Bible, it says to give to the poor too. So there's that. If you're conservative, that, and it's also Easter, so I'm going to say that. But yeah, but food stamps only takes up less than 1% of the budget. So it's definitely not that. That said, if we can, I mean, so yeah. Also, here's something to get you really mad. H&R Block and TurboTax. You pay it every year. You pay your taxes. You pay it through a tax scam. This is one giant racket. Basically, H&R Block and TurboTax pay the government to keep your taxes intentionally complicated, and so you have to do them yourself. So you have to pay. So you have to come to pay them to get your taxes done and turn them into the government. You only need to do it because these two companies pay politicians corruptly to make you do more work, which you shouldn't have to do because they paid them to do. It's ridiculous. And every other developed country and many other undeveloped countries, the government will do your tax form for you. They have the information from payroll tax information. They have it from employers and stuff. They just do the math for each employee, do all that, enter that, and then send you a form saying, is this correct? And if it is, and if you might want, or as it is, you sign it and send it back. Done. In the US, we have this long, convoluted, stupid process that gives everybody a headache in tax season. And it'd probably be, if people didn't have to worry about it so much, I think half the apprehension against taxes would probably go away. Because it's not taxes that are the biggest problem. It's that wages have not increased since the 80s with inflation. That's the biggest issue. That's the big thing. And nor have they necessarily with benefits. That's out for debate. Okay, see you next time.